Does it matter what type of fibroid you have? Watch this video to the end and you will learn the different types of fibroids that there are and how this could possibly impact the symptoms and the treatments that one can have for fibroids. Hello, I'm Dr. Sylvia. Welcome to Askawayhealth. We provide you with direction and clarity about everything medical. Please subscribe to our channel and be sure to click the notification bell as well so that you can be informed whenever we publish a new video, which is usually every Saturday. Fibroids are benign growths that happen in a woman's uterus or womb. They're quite common, happening in about 30 to 40% of women. I'm quite confident that by talking about the different types of fibroids that there are, some women might actually understand their symptoms better, and this might help in terms of deciding which treatments to choose. Having looked after women with fibroids in the past, it's really important to understand that every woman has different symptoms, and it's good to understand the symptoms and how they have happened in order to make sure that each person gets the best treatment available for their particular type of problem. First, let's talk about the structure of the womb. The womb is made of 3 different layers. There's an inner layer, which is the cavity within which the baby is carried, and that's called the endometrium. There's the middle layer, which is made of muscle, and there's the outer layer that is closely related to other organs within the abdomen or the pelvis, and that's called the perimetrium. The first type of fibroid I'll talk about today is the commonest type, and is called the intramural fibroid. This type of fibroid grows within the middle layer or the muscle layer of the womb. The second type is called the subserosal fibroid. Now this develops and grows outward from the womb into the pelvic cavity and actually can grow quite large. Now it's responsible for the kind of symptoms we refer to as pressure symptoms, and that means that it can contribute to symptoms by causing pressure, pushing against an organ like the bladder, or pushing the womb against the rectum, which is lying behind, or even pushing against certain other structures in the abdomen, like the intestines. So people that have subserosal fibroids may complain of symptoms like problems with passing urine. They might have an urgency to pass urine, or find that they cannot control their bladder. This is because of the bulky fibroid pushing against the bladder. Or they might experience symptoms like constipation, again because of a bulky subserosal fibroid pressing against the rectum at the back. Okay, so just before we continue, I'd like you to comment down below, because I'm really interested in finding out what aspect of fibroids do you think are the most distressing. Is it when it comes to finding a diagnosis, actually getting through the symptoms and getting the right diagnosis, or is it about getting the right treatment? For one person it might be different, but if you comment down below, it would be good to understand the different feelings that people have when it comes to the full management of fibroids. I'm looking forward to hearing from you about this. Now the third type of fibroid is called the submucosal fibroid. Now that grows inward from the muscle layer underneath the inner lining of the womb, and it grows into the womb cavity. Now as you can imagine, this fibroid can cause problems like increased or heavy bleeding. It can also cause a distortion of that smooth regular cavity of the womb, and that could cause a lot of problems. Either it makes it difficult for the fertilized egg to implant properly within the womb, and so that can lead to recurrent miscarriage and eventually lead to problems with fertility and being pregnant. Now, in addition to these 3 main types, we also have what we call pedunculated fibroids. Now basically that just means that there is a small stalk of tissue that connects the fibroid muscle itself to the rest of the womb. This can either happen in the outermost, from the outermost layer of the womb, so a small stalk connecting the fibroid pushing out into the rest of the pelvis, and that's called the pedunculated subserosal fibroid. Or it could happen right within the innermost layer, and then you have a small stalk of tissue that connects the fibroid to the inner lining of the womb, and that's called a pedunculated submucosal fibroid. So these are the ways that fibroids can grow within the womb, and as you can imagine, their positioning could contribute to the different symptoms that they present with. In my very next video, I will be talking about the symptoms of fibroids, so make sure you link in to get a notice of when that video comes out. And if you have any questions in particular about the symptoms that you want me to talk about, make sure you comment in the section below so that I can have a look and provide you with that information as well. In the description below, I've shared a link to the heavy menstrual period checker, which might be useful for some women who are not sure whether their periods are irregular and might want to have a discussion about their doctor. That checker just helps you to go through the particular signs that a woman might have if she's suffering from bad heavy periods, and might help you decide when it's appropriate to see your doctor. Okay, that brings us to the end of the video. Thank you for watching. If you've liked it, please show by leaving a comment down below and liking the video as well, and please share with somebody who you think might find it useful. As well, consider subscribing to my channel, because that really helps me push out more videos like this. So until next time, have a great day.